There we go. And we are live. Hello.
Hey,
Hello.
hey.
Very good. And I am Dr. Sarah Merritt from Lifestream Health Center in Bowie, Maryland. Dr. Lucie Mitchell and I were just speaking about unexpected interruptions, and my dog barks in the background just as we get started here, of course. So that will happen. But yeah, I'm with Lifestream Health Center. We are in Bowie, Maryland, trying to make pain management more caring, accessible, patient-centric, and evidence-based. If you're looking for a pain doctor in Central Maryland, come find us. We're at 301-860-0305 or visit our website at lifestreamhealth.com. Today, I'm joined by Lucie Mitchell, and she is a physician, Dr. Mitchell. She is practicing in Rome, Georgia, and sees patients for pain management. Dr. Mitchell, thanks for being here.
Thanks for having me. I'm excited.
And I believe that your background is very similar to mine in terms of your training after medical school. So you attended medical school and then residency in anesthesia and an interventional pain fellowship.
So I did residency at UAB, but I did PM&R residency, and then did spine and pain fellowship.
Got it. Yeah, so there are a couple of different paths to being a pain physician, an interventional pain physician, and certainly, yeah, that's a good one too. I know. That's great. So I didn't realize that you had the physiatry background. That's really kind of even better in some ways. So for any of our audience who doesn't know, anesthesiologists train in putting patients to sleep for surgery, and we learn a bunch about certain medications and certain procedures. But what's nice about the pain docs that are out there that are trained in physiatry is that they have a lot more training in dealing with people with injuries and rehabilitation of injuries, and physical medicine, is one of the names for that specialty. And so really a lot of background in hands-on treatment of patients. So that's great.
While they're awake.
While they're awake. That's right. Yeah. Yeah. And in my practice currently, I am awake patients all the time, pretty much. But yeah, I hear that. Well, good. Well, I'm interested to hear a little more about your journey. So I understand that you also do some art, some you produce pieces. Tell us a little bit about what you do and how that interfaces with your other work.
Yeah, and so typically, like you said, I'm a physiatrist and I do spine and pain as well. Mm-hmm. But when people come, in with pain, there are all types of pain issues, and they're in the exam rooms and they're just waiting. It's a very dull space to be in, a headspace, but also the actual physical room. Mm-hmm. And what I realized was that when I put like pictures on the wall, as far as abstract paintings, colorful paintings, some of them are on like the darker side of paintings, but they tend to almost forget why they're here and focus on something else, And so that seems to be something that puts somebody into a different headspace, when they're coming in. And so for me, for example, I love to paint, I love to color, I love to draw, I love to sketch, and finding a way to incorporate medicine with what I love to do was, in the beginning, impossible for me. Mm-hmm. Only because the stigma of, oh, you're a physician, so you do that and just that only, right? Okay. And we never had like that pathway that says, hey, you can do that and so much more, right?
Yes.
But since COVID, we didn't have a choice. It was, hey, you're going to do that and that and that. And I'm like, well, wait a minute. This is a lot. And so what else can I bring to the table to help alleviate a lot of that burden off of me? And painting was it. And so now sharing that with my patients, it seems to have a positive effect on the patients, because now they have something else to talk about besides pain, which is, what they're here for. But it calms them down when they're in the room. Mm-hmm. They can, look at abstract pieces and try to figure things out. Sometimes they'll say, hey, I have back pain, but then they'll stand up and look at a painting, up high, And so, and that's also the stretching. And so all these things that they can do without even realizing, helps, put things into perspective for them.
That's so interesting. And so had you been an artist prior to the pandemic, or this was something that started, with the pandemic and its infancy?
Yep. So before, since middle school.
Okay. Yeah. This is not a new thing, but new to incorporate it into your, into your practice and very good. And so if I were to visit your clinic, it would have some of your art on display?
Yep, you'll see some art on display, but also too the hospitals as well too. You'll see some of my stuff there as well. And so hospitals are known for you walking down these hospital halls. You know, you have all the pictures like of people from way back when in the hospital. It's like, it's creepy, it's boring.
Right. Like, who
You
is that
know,
person on the wall? That there's
right. And it's like, it's
no
already a
idea.
dull place. Nobody wants to be there except for us, right?
Sure.
And then so when you go on a rehab unit, you're there for an extended stay. But even then, the rooms are, again, four walls. There's like a whiteboard in the room, a dry erase board, and a TV, and that's it. And so I started adding some art pieces to the patients' rooms. And even just that alone would spark discussion. You know,
Yeah.
someone with a stroke, they can start looking at things and then kind of like, you know, work their mind a little bit.
Yes.
You know, and it brightens
I
up
think
that
it's so
space.
interesting that it's more, I guess your work tends to be more on the abstract side. And so something that might engage the mind in a different way than just a portrait or a landscape, maybe.
Right. And it opens that space because then it gets you thinking as far as what do I see versus what is actually what it actually is. So for a landscape, it's a landscape. That's what it is, right? There's no thought behind that for a person, for example. But an abstract piece, you're like, wow, here's what I see, but what is it really? You know?
Yeah.
And with that sparks, you know, it works your mind. It's like a little puzzle that people get to, you know, try to figure out.
Yeah.
You know, and
I
I
mean,
like that.
Very cool. Yeah. Well, and the artist's intention and maybe the observer's interpretation is valid too. It's just a different interpretation, right?
Yeah, exactly.
That's super cool. Well, and I think you may be onto something because, for instance, you know, we do know that there's scientific data about perseverating on pain, right? That it's healthy for us to, while we might, you know, acknowledge if I'm a patient with chronic pain, acknowledging it, yes, but maybe not spending all the waking moments thinking about it, but you know, thinking about other things, trying to be functional in other ways, and that really focusing on the experience of the pain itself is often negative toward the patient's perception of pain.
Right. And it becomes a cycle, you know, the pain cycle, right? And I tell a patient, you know, the first thing you do when you wake up, if you're thinking about pain, that's going to be your entire day, right? And nothing you do is going to break away from that cycle. And so I ask my patients, I'm like, you know, what do you guys do that can, you know, help you take your mind off of that, right?
Yeah.
And so, for example, I say it doesn't have to be art, but it could be, you know, somebody might like to sew, or they might like to crochet, or just go out on a walk, or just, you know, sit on the porch and watch the birds fly. I don't know, but something else besides that, because once you are so focused on that pain and how it hasn't gone away, then that's when the problem starts, right? Because I tell patients, I'm like, you know, when you want things to be fixed versus managed, two different things, right? And so, for example, I'm in my car now, right? So I'm going to open the door, for example. So if I get out my car and lock myself outside, right? Maybe I didn't, but if I did, you know, that can be fixed, right? Somebody can come in and help me unlock the car and bam, I'm okay, right? I'm only mad for 2 seconds. But if I take like a thing and you know, my car crashes, right? And it's totaled, you can't fix that, right? And so that becomes, I'm pissed off now. You know, I can have a whole new car later on. I'm like, yeah, but instead of my car, I missed my car.
Yeah, you can't.
So the same thing for pain.
And eliminate it.
So the same thing for pain. I tell folks, you know, we have to be realistic, right?
Yes.
In terms of what we expect, but what's actually reality, right? So for arthritis, for example, I tell people I can't fix arthritis, but I can help you manage it.
Yes.
It doesn't have to be just through medication. It could be through a different form of therapy that is good for you, whatever that may be for you.
Right. Yeah. And I think so often we do get kind of hung up in the fix, or if it's, you know, this idea that it must be, you know, fixed in some definitive way.
Right. And so I think now, you know, when it comes to majority of my patients, you know, I always say, hey, because I always say, oh, can you fix me? And I'm like, I can't fix you, right? Because I didn't break you. I can't fix you. You might not even be broken, but I can help manage whatever it is the problem is, though.
Yes. Man. Yeah. And I think that's why we call the specialty pain management sometimes, because, right, it is not necessarily all, you know, pain reduction increase of function, those are usually the goals. But to promise a zero pain is usually promising more than we can deliver, frankly.
Yeah.
Yeah. That's great. That's great. So I think that's really important to, work with patients on that mindset, and how to use, just using those concepts, right, to advance one's own care. I think it's a really big deal. That's great. Yeah, I think that for patients, I like this idea around like the things you can fix and the things that you can't fix, or just reframing, I guess, in some way.
Yeah, because what I realize is, we went to med school, we did all this training, and so we know what is and what is not. But for a patient, they know Dr. Google and what Dr. Google can offer,
Yes.
And and I tell people all the time, Google's fine to an extent. However, when it comes to managing your pain, it's not just what I can do for you, but it's what you can do for yourself also.
Yes.
And so kind of breaking out of that cycle, that pain cycle.
Yes.
And whatever that looks like for each person. And I said, for me, yes, I'm a physician, but I still have pain, I still have pain. Sure. I get pain in my neck a lot, right? And it could be horrible, debilitating, but I know that I have to keep moving, right? I can't sit there and let that dictate my entire day or my entire life, because there's so I'd be in the bed all day, and that's not a quality of life that I want for myself.
Right.
And so the key thing is going to be, one, quality of life, how can we manage it? And what are some things outside of your typical things that we can do to help, with that and get your mind off of that, for example. And for me, that's art.
Yeah, that's awesome. And maybe we could talk a little bit more about the pain cycle. I'm going to see if I can even bring up a little picture or something, because I think I haven't really addressed this in some time, but I think it's important. I think it's kind of the idea of, and you can kind of tell me about the points that you think of on the cycle, because I think different people word it differently, but kind of this idea that a person has pain, and then you might have a pain response, which might include less mobility, thinking negatively about pain. I think I already said less mobility, but that's certainly a big part of it. And then that feeds back into more pain, and then you kind of cycle around. Are there other pieces as well that you find in the cycle, or that you think about? Those are the ones that come to mind right away.
Yeah, and I think about too, as far as how the mental health portion of that cycle.
Yes.
Which is like you're no longer as mobile as you used to be, right? And now you're thinking all these negative thoughts, and you're letting those thoughts consume you, and that becomes more of a burden. You continue to lay in the bed more often, so now you're not moving anymore, or not as much, and your body's hurting more because why? You're stiff, the joints are stiff, the muscles aren't being used. If you don't use it, you lose it, and then now it becomes this whole thing. It's been like, it's been 3-4 years down later, and you're like, wow, how did I get this way? Because you're so consumed in that cycle, you never thought about getting out of the cycle,
right?
Or something else to come in and blocking that pathway for you.
Yeah, and I think this idea that a challenge that I have sometimes is in terms of working with patients to make sure they understand that whatever they can do function wise is valuable. Well, hey doc, I can't, I used to run, I can't run. Okay, well, what can you do? Can you walk? Can you take a 1 block walk even? I can't walk as far as I want to go. Okay, well, that 1 block walk is still valuable, and we need you to do that, because the body is a use it or lose it kind of thing. And so we need you to be, within some boundaries, maximizing that function.
Yep. And I tell people too, I'm like, it's like, well, I'll sit down, I sit on the couch and watch TV all day. I'm like, okay, fine. Do you have exercise bands? Do you have weights? If not weights, a can of tuna, a can of something, a can of soup that you can lift weights with, so you can keep your arms moving, right? During commercial breaks, move your legs some up and down, something, so that way there's no excuse, And I tell them, I'm like, you came to the office today, so you moved.
Yeah. I think that's amazing. I think that's really amazing. I think, and maybe this is like human nature to a degree, right? That we're sort of wired to, frankly, I think we're kind of wired to see the deficits, right? We're wired to, see the things that we've lost, or the things that aren't right. I think that but if we can take a minute back and reflect and like, well, be grateful for the things we can do, and then to do them, it's just such a game changer in people's lives as I see it.
Right. And I think we like labels also, like negative labels.
Okay.
And so
Yeah, tell me more
somebody
about
will say, oh, I have degenerative disc disease. And I'm like,
that.
yeah, we all do, in some shape or form. They're like, really? And I'm like, yeah. And I'm like, and just because you have that, it doesn't mean that it's affecting you. 9 out of 10 times, you probably don't even know that you had it for all this time. But now that somebody said, hey, you have this, now that label sticks in your mind and you think now there's something wrong with me. So I must hurt. That's probably why I hurt. It's not always the case.
Yes. Yeah, I think that's an interesting one. Absolutely, that those labels, right, people can get sort of attached to, and that reframing that hey, this isn't always painful. Well, right. I think really it's a message of empowerment. Like if you can get it where the patient can hear it, right? That hey, this is, you can be more active, you can do more. I think that is really a powerful thing, to just empower that patient to, take control of their own well-being as much as possible.
Oh yeah. And also too, I think, when a patient has something that we have, for example, like degenerative disc or, sciatica, whatever the case is, and it's like, hey, I have that too. And here's what I do. Like, what? You have that too? I'm like, I am human. I'm not, a robot. Yes, I'm a physician, but I do hurt also. I do have these things as well. And so I have a painting of my spine in one of my exam rooms. So somebody must say, oh, hey, I have this. I'm like, well, look at that. I do too. See, here's my spine and here's your spine. Yours look better than my spine.
Oh my goodness. Yeah. Yeah. Well, and I think that's the interesting thing about the nervous system and where all this ties in with the brain, right? Like pain is experienced in the brain, right? Like there may be sources, there may be peripheral stimulus, or maybe something going on in the periphery, but frankly, it's experienced in the brain. And so the picture isn't the end all be all of how you feel or what you can do.
Right. And so I think, a lot of times it's bringing it down to a level where people understand, like, yes, you hurt, and I know that it's affecting your quality of life. Yes. But one, how do we get back to whatever quality means to you, and what can we do to help, using whatever means that, that we have access to. But a lot of it's going to have to be something that you do, also for you.
Very good. As we've been talking, it occurred to me too, another concern, as I talk to patients who are trying to be more active, is the concept around maybe overdoing it, right? That if a person who's maybe, frankly deconditioned, although the patient may not know that, and they try to be more active. I found, I guess, in my own practice, in my own experience working with patients, it seems that overdoing it can be a big setback for people, right? If they get sore or have that experience of overdoing it, it might make them less likely to, do a higher exertion in the future. But when I talk to patients who might have physical limitations, we might talk about working a lot of the, the safe area where you can be, hey, let's do work all this zone that you can do, and then eventually that zone can get bigger. How do you talk to patients around that issue of overdoing it?
Yeah. So I tell patients, imagine if I am trained to become a bodybuilder, right? And so, which I have never done in my entire life, and I don't think I will. But if I were, right, I tell them, it's going to take some time for me to get to that point, right? And so after the first few days of me going to the gym, I'm going to hurt a lot. I'm going to be sore. I'm going to want to quit, because there are muscles that are waking up that I probably never even used before, so it's going to be a process. And so I tell them, I don't expect, overnight results, because it took a while to get to this point. It's going to take a while to get back to a point where you feel more functional, is what I tell them. And so when I say, they say, oh, I worked in the garden for 30 minutes and then, I was wiped out. I'm like, that's fine. 30 minutes today, maybe 32 minutes tomorrow, or you could do 30 minutes for the first week and the next week add 2 more minutes to it. Right. And so I tell them, I'm like, it's a process, because it took a while to get to this point. And so when I put it into that perspective, as far as me being a bodybuilder, right, and having to work for months and months on it, it's not just the working out, but then it's going to become, with the diet, the whatever it is I have to do on a daily basis. It's a process. And so I'm running a marathon, not a sprint, right?
Mhm,
And
mhm,
so they're trying to run a sprint. And I said, that's not how that works. And
mm,
so when I
mhm,
say that, now they understand that, okay, yes, I hurt, which is okay because
mhm.
it's going to get better with time. And that's the
Yeah.
key thing is I tell them it's time because they want things to be done now and tomorrow. So that way
Yes.
they feel better tomorrow. And it's like, that's not how your body works.
Mhm, mhm,
Even for a kid can bump their head today, they still hurt tomorrow, but they keep moving, right?
mhm.
We
Yeah.
bump our heads, but like, oh my gosh, I'm taking the whole week off, you know?
Right, right.
It's like we have to learn to be okay with, you know, a little bit of pain
Mhm,
to get through to the next step. Now, if you're in pain and it's like because something is totally wrong, then yeah, of course, you know, you want to stop. But I
mhm.
tell folks, you know your limitations, listen to your body and let it guide you to the next step. But you have to
Yes.
be willing to do that.
Yes. Yes. That's great. I like, yeah, using, I think, the marathon, not a sprint idea. Well, because really some of it is this idea that not every painful feeling in your body is a disaster, right?
Right.
Like, I think kind of getting to that point to understand that, you should listen to your body, right? I think you're saying that too. But how do we learn to, I don't know, edit that or better understand it, that not every painful signal is an alert that really means there's a problematic disaster going on.
Right. And so, like I said, I'm like, you know, if I'm building muscle in the gym or if I'm, you know, walking around the block, you know, my legs are going to hurt, my thighs are going to get sore, but that's an okay feeling. I'm not going to like how that feels, but
Hmm.
it's still okay
Yeah.
because this is something that is new for me to do. I'm trying to build something and it's going to be some aches and pains during that process, but it does get better with time.
Yeah. Yeah. That reframe. Yeah. That's great. Yeah, and I think the bodybuilder might say to you that pain is weakness leaving the body, right? I've heard that. I've heard that saying before. I don't know if I'm ready for that to be a therapeutic message just yet, but I can
Not
see
yet.
if you're in the bodybuilding realm, that might be part of the discussion. That's great.
Yeah,
Well,
but I always, you know, tell them like, you know, just make sure that they find something that works for them, you know,
mhm,
because I tell them like, you know, art is my thing, but it might not
mhm,
be your thing. You know, you might say, because I have patients that say, well, you know, I like helping other people. And my message is you can't help others if you don't take care of yourself first. If
mhm.
not your best you can't expect to get somebody else 100% when you're not even at 100% for yourself yet.
Right, right. Yeah, and so what kind of things do you talk to patients about for that type of self-care? I mean, just finding an activity that they like or
Yeah, an activity, you know,
Mhm,
I have some patients who they don't like, you know, they don't have anywhere to go or like, you know, or don't have anybody except for themselves. And so
mhm,
I say, you just have to take a chair, sit outside, people watch.
mhm,
If you don't
mhm.
have people in your yard, just see what's out there, right? Or do a puzzle, play solitaire, just something to exercise your mind. Because
Yeah,
once your mind has that distraction, but a good distraction, then
yes.
whatever pain that was secondary, it become it's no longer in the forefront,
Mhm,
right? But once you find some activity, and not just watching TV, but an activity that you like to do, that you can
mhm,
even do at home or whatever, then that will take over, you know, what your mind wants to do. You'll say, oh, I can't do this tomorrow. Oh, I can't to go do this tomorrow. Versus, oh, if I go to bed now, I'm going to hurt all day long tomorrow, right?
mhm,
And so I tell them it's going to become like a mindset shift. It's going to
mhm,
become a brain exercise that they'll
mhm,
have to be able to work on, whether they have somebody or not. Or even, you know, journaling is another option. If they
mhm,
don't want to write, they can just talk it out to themselves and record it, listen to it later, right? Some
mhm,
positive reinforcements. And so
mhm.
all these different things that they have access to now, right? I tell
Yes.
them, you know, when it comes to the world now, you know, there's a whole internet full of ideas of things that they can do without even having to leave home, but to
Mhm.
keep them active and to keep the mind exercised.
That's great. Yeah, so that's and then is that something that you might use as a touch point at your visits with patients if you were, checking in on somebody's progress? Is that uh, something I would imagine you might come to know what people's preferred interests and activities are over some time?
Oh yeah, I do. And it's funny because like when I'm charting as a patient there with me, like I'll
Hmm.
put a note at the very top that has like what they like to do. So I'll put like, oh, artists or likes to work with wood and stuff. So when they come in, I'm like, hey, what's the next? What are you working on now? Let me see the next project. Let me see pictures. And they know I love pictures. And so I always say, next time I see you, I want to see a picture of what you've been working on. And
Oh,
so
that's
they'll come in and they're excited to show me, here, here's what I've been doing.
mm-hmm.
Like I have a patient who built an entire, like a life-size dollhouse that his 8-year-old niece can actually walk into.
Oh, wow.
And that was somebody who was always, he was stuck in that pain cycle. But once he found him an activity, he's been so focused on that he hasn't even been concerned about his pain that much.
Mm-hmm.
And he's moving more.
How interesting. Yeah. Yeah. And I think, what kind of things do you hear from the patient at that point? Are they, are you getting reports like improved quality of life or different pain scores? Or, I guess sometimes I'll also hear patients say like, hey, my pain score really isn't that different, but, I'm doing more.
Yeah, I'll have patients who they'll have the same pain score for, the last several years,
Mm-hmm.
but they're like, hey, but I'm doing this. I can sleep better,
Mm-hmm.
I can roll over in the bed and stuff now without having to, complaining about the aches and pains. Yeah. Oh my word, that train is back.
The train, yeah.
And it just comes once, now it's coming twice around.
Oh boy.
But I'll get patients that I say, hey, distractions. But they'll say, hey, before I was not able to sleep in my bed, but now I'm sleeping in my bed. Because before I was sleeping on the recliner or the couch, but now I get to actually get in my bed. That I can get up at night to go use the bathroom and I still get back in bed and do okay.
That's awesome. Yeah. And like, that's a meaningful goal, I would think, for a lot of people. I've had patients who, if they have a spouse that they're, not able to sleep with, they're happy about that, or they're just happy of the normalcy of like, I want to be in my bedroom. I just haven't been able to be because of, not being able to tolerate a flat bed.
Right. And so all these things, and then and there's patients who they'll come and they'll say, hey, nothing has changed. Right.
Mm-hmm.
And I'll ask, well, what are you doing? Or what have you done? And it's like, well, I haven't had time to do this. And I really couldn't do this. And so then it's like, oh, well, they put their own barriers. And I say, when you have all these barriers and excuses, then you won't be able to get better. I can't help you get better without you having to do your part also. This is a two-way street. And so I say, I can tell you all these things all day long, but if you're not implementing them or even attempting to, and all we're getting are excuses, then we're here. And then they'll say, oh, well, yeah, that's right. I'm like, so you have to do your part. I can only get you so far, and then it's all to you.
But it sounds to me like you're sticking with patients through that journey, right? You're not like, see you later. It sounds like you're, hey, let me help you. Let's go on this journey together. That's
And I'm like, and I want to see the progress. I want to see the pictures. I want to see the videos. And so I see tons of videos. And one person recorded his wife. She was working on something on their porch. And they say, I'm like, where'd she go? She fell off the porch. And then you see the camera fall. I'm like, oh my goodness. I'm like, I didn't do that now.
Oh my gosh.
When you see a thumbs up like in the camera, I'm like, okay, well, she's good.
That's right. The husband's a patient or the wife's a patient. But yeah, right. Oh my goodness. Yeah, she'd be coming seeing you next.
I know.
That's funny. Yeah. Well, thank you so much for that. I think that's all really great stuff. And just to be reminded of how, I think, again, it's like just really a message of empowerment that, for patients to improve, yes, we have pain doctors, interventional pain doctors that want to help and can help, but there are other ways. There are ways that patients can help themselves too. And to be able to counsel on that and teach people skills, I think that's super interesting and valuable.
Yeah, because I tell them, I'm like, hey, we can do injections, we can do medications, but it doesn't have to be one or the other. We can do a variety of things because the goal for me is what's going to improve your quality of life at the end of the day.
Nice. Yeah, absolutely. Absolutely. Well, tell me a little about your practice. Where can patients find you? I've put some links in the chats here for your Facebook page and website and Instagram and I think these are mostly around your art, but I'm glad to, share both kind of the links and information about your art and your work, but then also about your practice.
Yep. So I am in Rome, Georgia, and I'm at Harbin Clinic. And so they can find me there, spine and pain. And so I'm also rehab at Advent Redmond across the street from the clinic.
Okay.
As well as somebody's in acute patient rehab. I'm there as well. So
awesome. Well, thank you so much. Yeah. And please check out Dr. Mitchell's pages here. Here, I'm going to share some of this. Her website is this phoenixnoirdesigns.com and has Facebook page under a similar name. Come check it out. So I'm going to need to check it out to think about upping our game for our art in the office. My walls are a little boring. We have some plain walls, and we also have some walls with various medical diagrams on them, but we don't have much art, and I've just not gone there, but I think maybe I should after this conversation.
Oh, there you go.
Great. Well, good. Well, thank you so much for joining us, Dr. Lucie Mitchell. We appreciate you, and thank you for leaving our audience with such great pearls on managing with chronic pain.
Well, thank you, and thank you for having me. And sorry about the train that came twice. It never comes twice over here.
So if you're in Rome, Georgia area, please come find Dr. Mitchell. If you are in Central Maryland or Washington, D.C., come find me at Lifestream Health Center in Bowie, Maryland. Thanks.
All right.